CBS News Colorado is with the Senate candidates discussing mental health as voters decide.
Hello, everyone. I'm Sean Boyd. I'm the political reporter for CBS News Colorado. Thank you for joining us today for the Meeting of the Minds U.S. Senate Candidate Forum on Mental Health. It's hosted by Healthier Colorado, Children's Hospital Colorado, Inseparable, and the University of Colorado Anschutz Medical Campus. This is a first-of-its-kind, nonpartisan forum where Colorado's candidates for U.S. Senate will take up the issue of mental health, an issue that crosses party lines. I'd like to invite the candidates on stage now. Please welcome Senator Michael Bennett and Mr. Joe O'Dea. This forum is an opportunity for our candidates to share their plans to address the mental health needs of Coloradans if elected. We welcome a productive exchange of ideas and good faith disagreements. Because this is a life or death topic that impacts nearly every Coloradan in some way, we are hoping that decorum will appropriately align with the content. In other words, we want you to set politics aside and keep the conversation focused on mental health. My co-hosts today are John Daly from Colorado Public Radio, Jennifer Brown from the Colorado Sun, and Rob Waters with Mindsight News, and they will each be asking a question of their own. The rules for today's forum are as follows. Each candidate will have 2 minutes of opening remarks. I will then ask 6 thematic questions covering 4 different topics. The topics, but not the questions, were provided to the candidates prior to today's forum. They include investing in prevention, early intervention of mental health challenges and services for youth, addressing access to mental health services and treatment, building a crisis response system, and improving access to substance use disorder prevention, treatment, and recovery. The candidates will have 1 minute to respond to each question with an opportunity to utilize a 30-second follow-up if they wish. If they choose not to, they can save the time, and that can be used for their closing remarks. And I'd like to ask our audience to please refrain from any disruptions and hold your applause until the end of the forum is finished because we have a lot of ground to cover here. Let's get to our opening remarks. Again, each of you are going to have 2 minutes. Senator Bennett, we're going to start with you. If you are reelected, what does the landscape for mental health in Colorado look like in 2028, the end of this term that you are running for?
Thanks, Sean, and thanks to you, and thank you to the co-hosts in the Children's Hospital for having this forum. Joe, thanks for being part of it as well. We're facing an epidemic of mental health in Colorado and across this country as a result of an economy that for 50 years has worked incredibly well for the top 10% of Americans, but almost for nobody else. The opioid epidemic on top of that, COVID on top of that, the effect, as I say this as a parent of 3 daughters, the effect of social media on top of that, that our Surgeon General has called a science experiment that we're running on our children. These things have combined to create, a profound epidemic that we have to address. That's why I've been working with John Cornyn, a friend of mine from Texas, who's on the Finance Committee with me. We've released a white paper that some of you have seen that is a blueprint for what mental health ought to look like in this country going forward. And to answer your question very specifically at the end, what we need is parity. We need to treat mental health as seriously as we do physical health. That means integrating physical health and mental health together. It means making sure we go to where people are, like their schools, like their workplaces, to make sure that we're really integrating mental health into people's lives. And that's the work that we're trying to do together in a bipartisan way on the Finance Committee. I will say I'm really grateful that we passed the American Rescue Plan, because Colorado is now going to have $600 million to spend in rural areas and across the state, making sure that we're attracting and retaining and training the mental health folks that we desperately need. And then we passed $12 billion in the bipartisan gun bill to address mental health. That is, I think, the largest, if not one of the largest, I think it is the largest expenditure on mental health ever in the history of our country to support community health and behavioral health centers. So we're off to a decent start, but there's a lot more for us to do.
Okay. Thank you. Mr. O'Dea, please share your vision for mental health in Colorado.
Sean, thank you for having me host Children's Hospital, and Senator Bennett, good to be here with you today. The issue of mental health is deeply personal to me. At 14 years old, our daughter lost a very close friend to suicide. Our niece, just 4 years ago, lost a fiance to suicide on Christmas Day. And I don't know a family that hasn't been affected by mental health. My heart breaks for the young people of the country who are going through their struggles. We're failing our kids, and we have to do better. What's happening in America is not working. Partisanship is poisoning our country. My opponent votes with Joe Biden 98% of the time. It's not working. Inflation, 40-year high. It's not working. Crime's at an all-time high. Not working. Homelessness in Colorado is rampant. It's not working. And we add this list, mental health, especially for our kids, it's not working. During the pandemic, politicians isolated our kids for far too long. Many leaders spoke out. Parents begged. Senator Bennett, he voted with the union party line to leave kids out of school. And last year, Children's Hospital declared a youth mental health state of emergency. Teen suicide in Colorado has increased 58% in 3 years, making it the #1 cause in adolescent deaths. It's a staggering number. And since Children's Hospital declared the emergency, there's been a 23% increase in mental health visits to the ER. That's a 103% increase above the first quarter of 2019, which was before the pandemic. What do things look like 2028? Well, if we put a massive focus on these issues and we reprioritize our values, and we can turn the ship around. We lead. We do what's right by our kids. This debate is long past due, but it's about priorities.
Thank you both. Our first question is about access to care, or the lack of access to care. Federal law requires health insurers to cover mental health services the same as physical health services, but that often doesn't happen. The lack of insurance parity is one of the main barriers to accessing mental health and substance use treatment. Because mental health providers are not reimbursed adequately by insurance carriers, many don't accept public or private insurance, and this can lead to substantial out-of-pocket costs and delays in accessing care. If elected, how would you ensure the intent of the bipartisan parity law is realized and mental health providers receive sufficient payment for their services? Senator Bennett, you have 1 minute.
We obviously need to make sure it's implemented properly and implemented well. And as I said, that is the goal. It has to be the goal. Parity has to be the goal, and integration of mental health and physical health has to be the goal. I wasn't going to do this, but since Joe read his very political answer to your question, I just want to point out that he opposes the bipartisan gun bill that Mitch McConnell voted for. Some of the best bipartisan work I've seen since I've been in the Senate that resulted in our passing this historic amount of money, $12 billion for mental health. He said he would have voted against that bill. He said he would have voted against the American Rescue Plan, which is going to result in Colorado having $600 million to address this crisis. So, you know, words matter, and intentions matter, but votes matter a lot too. And I'm very pleased that Colorado is going to be able to begin addressing this crisis because of the votes that I've taken and the leadership that I've shown in the Senate.
Mr. O'Dea, you have 1 minute.
The American Rescue Plan, $1 billion to prisoners to pay their unemployment, $6.5 million to a golf course down in Colorado Springs, put in an irrigation system. I think there's a lot of issues with that bill. There's barriers, though, to what we're doing for mental health. First of them, one is a workforce problem. We've got to get training to counselors, therapists. We need to look at that as a partnership between business.
That's what the $600 million is going to, Joe. That's
Senator
what it's
Bennett,
going to in Colorado.
You'll have a chance to follow up.
Okay.
We need to look at training. And when we talk about training, it needs to be a partnership with business. It needs to be a partnership with colleges. It needs to be a partnership with four-year schools, community. We need to treat it as an intern program so that we can have businesses help us get more people into this industry. There's a shortage across the nation in every industry. This is no different, but we need to take a business type approach. We don't need government in the way. What we need is resources and make sure that we get across the finish line.
Senator Bennett, would you like
This
to follow?
isn't government in the way. This is government resources being used by the public sector and the private sector, among other things, to pay for the kind of internships that Joe is talking about, to give people the chance to have training in settings like Children's Hospital and health clinics all over the state of Colorado, so that we can deal with the workforce shortage. He's quite right that we have and that we need to address, but that's exactly what these pieces of legislation do.
Mr. O'Dea, would you like a 30-second follow-up?
The problem with this legislation is it helps to address Medicare. Those people are getting access. People with money, they can go in and they can afford to buy whatever services they need. When you start looking at the middle class, working Americans, we get left behind. Our insurances are when we're not allowing our insurances to buy what we need, there's a bureaucracy in the way. It's not addressing it for working Americans. The top and the bottom are getting taken care of. Working Americans are getting left behind.
Thank you. Our next question is from Jennifer Brown, who covers mental health issues for the Colorado Sun.
Mr. O'Dea, this question will go to you first. Substance abuse is a serious issue among adults and youth in Colorado. Both groups have reported that they're consuming more substances and are concerned about the amount that they're consuming. Yet, people seeking voluntary treatment are waiting on average 30 days before they can access substance abuse treatment services. What is your plan to ensure that Colorado has adequate substance use prevention, treatment, and recovery programs and infrastructure so that the state can meet the rising demand for these services?
Well, the first thing we need to do is address the supply side. Right now, we have a border that is leaking fentanyl at record levels. Colorado's #2 in fentanyl overdoses. Colorado's #2 in drug overdoses. And the reason is because we haven't attacked the supply side. I spent a day with Chief Pazin, and he and Sheriff Schrader talked about killing the supply side. They need some help. They're doing what they can here. All of their cars have Narcan in them. This situation is being caused by a border that hasn't been secured. We've got to start there. Second thing is this high-potency marijuana that's been approved. We've got to do more to get these marijuanas down to where they're, not killing our kids. And then the last thing, I hope Senator Bennett will join me in opposing this legalization of mushrooms that's on our ballot this year. We don't need more drugs in our society.
Senator Bennett.
I would say, first of all, I agree wholeheartedly that we need to address our border situation. I was part of the Gang of Eight in 2013 that wrote the bipartisan immigration bill that got 68 votes in the Senate. John McCain led the Republicans. And in that bill, we had $40 billion of border security. And it was not to build a medieval wall. It was 21st century border security that would allow us to see every inch of the border. I hope very much we can get back to that. When I hear Joe talk about this issue, often he focuses only on that and not on the question that you asked, which is how do we get people access? I think that we need our judicial system and our prison system to focus much more on recovery than they are today. People can't get treatment. And it doesn't make any sense to lock somebody up and not provide any treatment while they're locked up away from society. We could, I think, have a profound influence on the future of our country if we had more drug courts that were able to put people on a path to recovery instead of just incarcerating people with no treatment at all. And that's going to require us to think very differently about our judicial system.
Thank you. Mr. O'Dea, would you like a follow-up?
Well, we've got lots of laws on the books and we're not enforcing them. I mean, that's part of the problem. We need to put drug dealers away. Right now, we've got woke DAs here in Colorado that are turning people out on cashless bond. They can possess as much as 1 gram of fentanyl. It came down from 4 grams, but it's still too much. It's killing our kids. It's a deeply personal issue for me. My wife and I lost a very dear friend, 25-year-old daughter that overdosed here a year and a half ago. It's killing our kids. We need to put these people away. We need stiffer penalties for drug dealers.
Thank you. Senator Bennett, would you like a follow-up?
Yeah, I would just say that I think that there isn't a family in Colorado, including mine, that hasn't been touched by this crisis. You know, we have to do more as a nation to make China understand that they're going to face consequences if they continue to send precursor chemicals to Mexico to make these drugs. Part of the problem with these drugs is they're so cheap and they're synthetic, and you don't need a cartel, you know, to transport them. They're made in factories in northwest Mexico, and we need to demand a lot more out of Mexico too in terms of dealing with the gangs that are producing this poison that is killing our kids.
Thank you. Our next question comes from Dr. Jessica Hawks, Clinical Director of the Pediatric Mental Health Institute at Children's Hospital, Colorado. The New York Times recently reported that hundreds of suicidal children sleep in emergency rooms in this country every night. Over the last several years in Colorado, thousands of residential treatment beds for youth with mental health needs have closed, leading many kids to board for weeks on end in emergency departments, stay for months or even over a year in hospital inpatient beds, or leave Colorado and their friends and families to get treatment in other states. What would you do to ensure adequate access to appropriate residential, home, and community-based options, as well as preventative services for young people with complex mental health needs? Senator Bennett, we'll start with you.
Thanks. We have a chronic shortage all over the state, especially in rural areas, for those sorts of services. And that's what, you know, we're going to have to fund. We're just going to have to fund it, and we're going to have to find ways of paying for it. The Finance Committee on which I'm served is trying to figure out how to create some bipartisan bills to address this kind of thing, but other issues as well. Joe mentioned that seniors are taken care of and the poorest people are taken care of, but working people aren't. That's just not true. Everybody in this society is facing a shortage. Our children are facing a profound shortage. Seniors, Medicare, as you pointed out, doesn't reimburse the kind of stuff that you're talking about. And we need to change that. If we're actually going to have parity, Medicare is going to have to reimburse those sorts of things. And we're going to have to build more of those beds. I want to say also that we have to reduce childhood poverty in this country as well. That is creating enormous stress among our kids and among our families. And that's something I've fought for a long time.
Thank you. Mr. O'Dea?
I think we've got to start with our school systems. Right now, we don't have choice for all school systems. You basically, if you're in an underperforming area, your kids end up in that school system. If you look at the scores, the test scores, they're down, especially in communities of color, they're down 24, 27% are reading at age. We need to change that. We need to make sure that every parent can do what my parents did, which was put me in a school system where I could succeed. They made a choice. It monumentally changed my life. We need to start there. Kids have to have a future, and that future starts with an education. The closest thing to magic in the United States is school choice. Put them somewhere where they can succeed. We can get them mental health at those institutions. We need to be preventative and not reactive. $5 trillion, and we haven't addressed this. $5 trillion in the last 2 years, and we haven't addressed this. It's got to change.
Senator Bennett, did you have a follow-up?
Well, we are attempting to address it now with the $12 billion in that bill and with the $600 million that Colorado is going to be able to spend. And, you know, those are my priorities. Joe is for cutting, you know, taxes for the richest people, supports Donald Trump's tax cut for the wealthiest folks in America, blew a $2 trillion hole in our budget deficit. I think that's just misplaced priorities. You know, we got to decide that we're going to invest in the American people again, and that's long overdue, and that's what we need to do.
Mr. O'Dea, any follow-up? Do you support more funding for residential treatment beds?
I do, but I think we've spent $5 trillion in the last 2 years, and we got $12 billion out of $5 trillion. My God, why aren't our priorities on mental health? Why are they focused on education for our kids? Why aren't they focused on those things that are important to working Americans instead of paying criminals unemployment to be in jail? The priorities have got to change, and that's the reason I'm running.
Thank you. Our next question is from John Daly, who covers health-related stories for the Colorado Public Radio. John.
Thanks, John. While no racial or ethnic group in Colorado is immune to suicide, they are impacted to different degrees. For example, Colorado's young people from communities of color are more likely to attempt suicide. Colorado youth who are American Indian, Alaskan Native are nearly twice as likely to attempt suicide compared to white youth. What role does equity play in your vision for getting everyone mental health services and ensuring that they're appropriate to the needs of different communities? Senator Bennett, can you please go first?
Yeah, it's incredibly important. Our state is tragically leading the country in terms of teen suicides, and the growth has been extraordinary over the last few years. I think that we've got and equity should play an important role in this. I think that's one of the reasons why I've been so focused on the child tax credit, which cuts childhood poverty across the country and relieves people of the kind of stress that is not helpful. But there are other things we can do. I picked up the work that Corey Gardner was doing on the 988 suicide line, and with John Cornyn was able to fund that in the bill that Joe didn't support to make sure that that suicide line is available. I think that we've got to change the way our community, I'm running out of time, but change the way our law enforcement agencies are interacting with communities in the sense that the way we're doing it in Denver and on the West Slope and Grand Junction, sending mental health folks sometimes instead of police officers when a 911 call comes in. I'll use my other time to finish that thought, but thank you.
Mr. O'Dea.
Yeah, the STAR program is an excellent start. I'm familiar with that program. I think it's a great start. We need to fund it, though, and we need to make sure we understand that doesn't replace crime prevention. That's a tool. It's not a replacement. We've got major problems here in Colorado and across the United States, and they're all related. It's homelessness, it's drug addiction, it's suicide. All of those things go hand in hand. And I am with Senator Bennett that we do need to do more for the entire state, but we need to refocus some of the allocations that we've made over the past 2 years. To me, we've got money that hasn't been spent within some of the school systems now that was COVID money. We haven't used it. We should be using that to help our kids, help them mentally. Those are the type of items that I'd like to see us get done.
Senator Bennett, did you have a follow-up?
No. Oh, but I'll finish my thought on this, which is that if you look at in Summit County and in Grand Junction and in Denver, where they have a version of the STAR program that Joe just endorsed, which is great, when a call goes into 911, they make a decision. Are we going to send mental health workers? Are we going to send a cop with mental health workers? Or are we just going to send police officers? And in about 9,000 instances where 911 has dispatched mental health people, they've never had the need to send backup, which means the police officers can focus on violent crime, and hopefully people can get the help that they need and are less likely to be at risk for suicide or other kinds of trauma.
Mr. Day, follow-up?
No.
Thank you. We have one more question from our panel, this one from Rob Waters with Mindset News, a digital journalism organization dedicated to reporting on mental health in America. Rob.
Thank you, Sean. We've talked a little bit about the workforce crisis here. We know that there are not enough mental health providers, not even close, to meet needs that folks have in this country and in Colorado. How would you use federal levers to expand and develop our mental health workforce, including non-traditional workers like peer support specialists and community health workers? And the first question goes to Mr. O'Dea.
Well, I think we do have a problem. It's nationwide. It's in almost every industry. And I think it starts with junior high school education. We continue to tell kids that they need to go through a 4-year program, and that's important. It is important for some kids. Some kids are like me, though. They didn't do so well in college, and so what I did is I went through an apprenticeship program, and it helped me find my way. We need to have that same type of apprenticeship program available to healthcare workers, available to counselors, to therapists. Put them in a situation where businesses can sponsor them so they're getting paid while they're learning, make sure that the 4-year and the 2-year colleges, that those 2 curriculums line up so that when they transfer from one school to the next, they're not losing credits. We start at that level and we begin to grow a workforce, and that's how it starts, and that's how we get them into our industry.
Senator Bennett?
I actually agree very much with what Joe said. First of all, I don't think a kid should graduate from high school in this country without the skills to earn a living wage, not just the skills to earn a minimum wage. And that could be very important for our mental health workforce and our workforce generally. I think that we as a state have to figure out ways of making the job more attractive in underserved areas, whether that's rural or urban. We're not paying people enough in these jobs, and we're not embedding their training enough and showing them a path forward. I think that's something that we could do. And then I'm going to raise something that may sound unrelated to you, but is definitely fundamental when I'm traveling the state, all over the state. And that's the lack of affordable housing that we have in Colorado. We have no workforce housing. And there are communities all over this state where there are no mental health workers because there is no housing. And that's part of the crisis that we're facing. And I think one of the things that we can fix, but I'll save that for another debate.
Mr. O'Dea, did you have a follow-up?
No.
Senator Bennett? 30 seconds?
Is this the end or the?
No, no.
No, this is still this
You get
question.
another 30 seconds if you choose.
No, I think that's good for that one. Thank you.
Our final question is from a high school student, Charlie Schlingman at DSST Conservatory Green High School. Congress passed the Bipartisan Safer Communities Act in June, which included a record $1 billion for 2 grant programs that help schools hire mental health professionals. The law also includes $240 million for Project AWARE, Advancing Awareness and Resiliency in Education. Project AWARE provides grants to schools for mental health programs. Do you think this is enough, or does Congress need to do more to build community-based supports? Senator Bennett?
I'm proud to have voted for that bill that the student from DSST has asked about. Joe O'Dea, if he'd been in the Senate, would have voted against, says that he would have voted against that bill. But Colorado already has received $9 million of those competitive grants for schools that student is talking about. And yet, there's more that we need to do. You know, think about this. For those of you that know kids that go to, fancy private schools, think about the interventions that exist for children in those schools compared to the interventions that exist in public schools in America, much less schools where the poorest children in America go. This goes back to the equity question you were asking about. The stress that children feel, in these low-income neighborhoods, in schools where there are no mental health services, is traumatic. And it creates PTSD among children and their families. And we've talked a lot about this over many years. We've never done anything about it. Now we're finally beginning to do something about it. And I look forward to continuing to work with Senator Cornyn from Texas to be able to figure out what the next 10 years is going to look like.
Thank you. Mr. O'Dea?
Yes, I would have voted against that bill because it didn't go far enough. It didn't go far enough to fund mental health. That's a good start, but that's not near enough. We're throwing $500 million a year in the city and county of Denver at homelessness, drug addiction, and trying to get people into programs. We've thrown that in for every year. It's nowhere near enough. We've got to start from scratch. We need new programs that basically address this before it's a crisis. We've got to get to our kids. You've been in the Senate for 13 years. We still don't have school choice. I would like to see school choice for every kid in the United States. Imagine that. Imagine you can take and put your kids somewhere where they can be successful. That's the key, is we've got to start at that level and reinvent our systems. We can't continue to throw money at things that aren't working. It's not working.
Senator Bennett, did you follow?
Well, are we throwing money at it, or is it not enough money? You just said the bill didn't have enough money. Now you're saying we've got to stop throwing money at it. And this is the first time you've ever said it wasn't enough money. What you said was America doesn't need any more gun laws. That's what you said.
And that's true.
That led you to say to the people of Colorado that you would not vote for a gun bill that Mitch McConnell supported. And that, speaking of mental health, that Colorado should get rid of its red flag law. That's Joe O'Dea's position on guns. So we need to be straight with the people of Colorado.
Mr. O'Dea, follow?
Under your watch, crime is up 30%. 30%. You've been there 13 years. We don't need any more laws. I refuse to be lectured by someone party that hasn't enforced the laws that we have on the books today. If you're a drug dealer, you get caught with a gun, it's not a felony. That's not right.
All right. Before we get to our final remarks, I want to thank our hosts, Healthier Colorado, Children's Hospital Colorado, Inseparable, and CU Anschutz Medical Campus. I'd also like to thank our media partners, CBS News Colorado, Colorado Public Radio, Mindset News, and the Colorado Sun. And finally, thank you both for agreeing to participate in this very important forum. Mr. O'Dea, you have 2 minutes for your closing remarks.
Thank you again for hosting this truly important conversation. We owe a debt of gratitude to those that work on the front lines to address this crisis. This election is about priorities, about leadership. And the question is, can we take another 6 years of misguided focus? We've got record inflation, record crime, record drug overdoses, out of control homelessness here in Colorado, an education crisis, a mental health crisis, suicides at an all-time high. Like all of you, I'm worried about the direction this country is headed, and we need change. We need change in leadership, we need change in focus and priorities. And let's stop the reckless spending and direct it at our kids, our youth, our young adults to help with the access to education for all zip codes. Access to mental health services and treatment, prevention and early intervention of mental health challenges before kids are in a crisis. What will it be? 6 more years of the same? Or will we send someone new back there, an outsider, not a politician, with a mandate to fight for us, to fight for Colorado, to make change, to work with anyone to get results? I'm all in for Colorado. I want your vote, and thank you for having me here today.
Thank you, Senator Bennett.
Thank you, Sean, and thank you all for co-hosting it. Thank you for the questions. This is a deep, deep concern for every single parent in Colorado, every single teacher. We've raised 3 daughters here in the state who are now 23, 21, and 18, and I've seen the effects of opioids, of COVID, of interrupted schooling, of the economy on my daughters as well as their generation, and they need us to act, and I'm very glad that in a bipartisan way the Senate came together. I was part of the leadership of that bill to get it over the finish line, and now we're gonna have to implement it. I want to go back to work with John Cornyn, my colleague from Texas, to see what more we can do to make sure that we're integrating, we're changing the incentive structures in our programs so that we're integrating physical health care with mental health care so that we're getting to where people are, as I mentioned, our schools, our workplaces, our churches, and other places. And so we're changing things like the way the Medicare program works so that people actually do have the benefit of mental health care, which today they don't. And I think we also need to take on the issue of treatment and recovery in our society to acknowledge, that this country has been uniquely addicted to opioids compared to any other country in the world, and we haven't yet responded to that challenge. If you send me back to the Senate, I will do everything to make sure that we do. And so I thank Joe O'Dea for being here today as well, and look forward to the next 3 weeks. I hope you'll vote for me, and please make sure that you and your neighbors all vote.
Thank you. Thank you both for being here, and thank you all for being here. This concludes the Meeting of the Minds U.S. Senate Candidate Forum on Mental Health. Election Day is Tuesday, November 8th, and ballots are now in the mail.